For decades, patient dumping described a specific emergency room problem, hospitals treating someone for a medical crisis and then abruptly leaving them on the sidewalk. By 2026, that practice has transformed into a systemized pipeline. Now, the transition runs directly from long-term care facilities straight into local homeless shelters. The residents entering this pipeline are often navigating significant mobility or cognitive limitations, requiring around-the-clock clinical supervision that a shelter is not equipped to provide. While the term eviction usually applies to apartment rentals, in 2026 it has entered the medical sector, shifting seniors from professional care environments into the unpredictability of the streets. A specific federal law exists to prevent this, the Nursing Home Reform Law. Under this statute, long-term care facilities are strictly required to provide a written 30-day notice before they can involuntarily discharge any resident. Staff must also legally document that the resident is being sent to a safe and appropriate destination, one capable of actually managing their daily medical needs. So, if federal law mandates a medically equipped destination, how are care facilities successfully placing seniors in emergency homeless shelters? They aren't ignoring the law. They are navigating an administrative loophole that allows them to bypass these protections entirely. Care facilities prioritize residents who pay out of pocket, private pay residents, because they generate significantly more revenue than those relying on government subsidies. The financial pressure begins when a resident's personal savings run out. Once those funds are depleted, they must transition to Medicaid to cover the cost of their bed. This transition became more difficult after the 2025 Reconciliation Law, which introduced sweeping federal spending cuts to the Medicaid program. These federal cuts force state governments to lower the daily reimbursement rates they pay to nursing homes, tightening the budget for every Medicaid bed. When the Medicaid rate fails to cover the facility's internal costs, residents without family advocates or personal wealth are often the first to be identified as financial liabilities. Federal law prevents a facility from evicting a resident simply because they have transitioned to Medicaid. To get around this, administrators reclassify the financial move as a medical necessity. Instead of citing a lack of funds, the paperwork will claim the facility can no longer meet the resident's complex behavioral needs. This shift in terminology provides a legal bypass, allowing facilities to ignore the financial protections that are supposed to keep residents in their beds. However, the facility still has to prove the shelter is a safe discharge. Because shelters lack clinical staff, this should be a difficult legal argument to win. But the real estate market provides a cover. This chart shows senior housing occupancy approaching 90%, while rent growth continues to climb. In the lowest pricing tiers, subsidized apartments and low-cost assisted living, the available inventory is virtually non-existent. Social workers use this lack of inventory to argue that since there are no open beds in the entire region, an emergency shelter is the only physically available option. The macro housing crisis provides the legal alibi. By citing zero inventory elsewhere, facilities technically meet their discharge requirements while moving the resident to the street. The core of the problem is a structural deficit. For every 100 low-income households, the U.S. has only 35 deeply affordable units available. While that shortage persists, individual residents have one primary defense: the right to appeal. Filing an appeal halts the eviction process. While the hearing is active, the facility is generally prohibited from forcing the resident out. In states like Ohio, the legal standards for these hearings are high. Facilities must provide specific documentation from a physician to prove a discharge is necessary. Under Code 42 CFR Section 483.15, difficult behavior is not a sufficient legal ground for eviction if the facility hasn't first attempted and documented reasonable accommodations for the resident. The long-term solution requires addressing the shortage of senior housing. Until then, exercising these specific legal rights is the most effective way to prevent a resident from being pushed into the shelter system.